Good day, everyone. Welcome to our Nloa 1 prelim, and we focused on our first topic, which is basically on healthcare delivery system. So, question number one: which of the following best describes the structure of the Philippine healthcare delivery system? A. It is a three-tiered system composed of primary, secondary, and tertiary levels of care. Letter B. It is a decentralized system with local government units primarily responsible for healthcare delivery. Letter C, it is a centralized system under the direct control of the Department of Health. Letter D is a private sector led system with minimal government involvement. It's already immediately wrong on letter A and check letter D because we know that it's actually not a three-tiered system, but it's actually going to be a two-tiered system. That's actually public and private partnership. And letter D is also wrong because that's focused on private. So the best answer for number one is letter B because we know that the local government code of 1991, which is basically RA 7160, decentralizes the health system, transferring the primary healthcare services to the local government unit, and considered to be the Department of Health is actually responsible in the provision of policy, standards, and technical assistance, while the LGUs manage local health services. Number one, the best answer is letter B. Number two, a community health nurse is conducting a health education session on universal health care. Which statement best explains the concept of UHC in the Philippines? A. It tenures that only the indigent population receives free health services. Letter B. It mandates that all Filipinos are automatically enrolled in the National Health Insurance Program or PhilHealth. Letter C. It focuses on hospital based curative care rather than preventive and promotive. Letter D. It eliminates the need for private health insurance. Letter D is actually eliminated because that's actually the choice of the people to have private health insurance and know that it should be focused in the community rather than in the hospital. So letter C is also eliminated. The answer here is letter B. Letter A is actually going to be uh, very absolute to have care only for the indigent. Number two is letter B because of course we know that Universal Healthcare Act, which is RA 11223, that ensures automatic enrollment of all Filipinos in PhilHealth in prioritizing the primary care and at the same time financial risk protection. It does not eliminate possible private insurance, but usually it aims to have an equitable access to quality health services. Number two, answer Bravo. Three, the community health nurse is implementing the service delivery network approach in a rural area. What is the primary goal of service delivery network? A, to focus on hospital-based care for underserved population. That will be to ensure seamless referral and continuity of care across healthcare facilities. Letter C, to promote the use of alternative medicine as a primary health approach. Letter D, to limit the role of local government units in healthcare delivery. Of course, we eliminate letter D because of the devolution. It means that they have been given the power to control over their community. Then alternative medicine is actually included, but that's not that we are going to be using this in a community setup. Number three, the best answer is letter B. That is to make sure that there is strengthening of the referral system by making sure that there is proper collaboration, coordination among the different levels of healthcare facilities so that the patient will be able to receive an appropriate and continuous care during the referral. Number three, answer Bravo. Four, which of the following is a primary function of barangay health workers in the Philippine healthcare delivery system? Provide complex medical service treatments and prescribe medications, perform surgical procedures under supervision, serves as community health educators and assist in primary health care, or focus on traditional health and alternative medicine. Answer here is letter C, because we know that RA 7983 or the Barangay Health Workers Benefits and Incentives Act usually assist. The major role and responsibility of this barangay health workers or BHW is to assist in the basic health services and at the same time on health promotion activities within the community through the conduct of education classes. Four, answer C. Five, which government agency is primarily responsible for ensuring the availability of essential medicines in rural health units? A. Philippines or PCSO, letter B, DTI, letter C, DOH through the Philippine Drug Price Reference Index, or letter D, BIR. Of course, we know that that should be letter C. That's DOH under the Cheaper Medicines Act, or that's RA 9502 that regulates the Drug pricing at the same time ensures that there is presence of essential medicines that are affordable and accessible to all. 5. The answer is Charlie. 6. A, a community health nurse is educating a family in the Formula One Plus for a health strategy. Which of the following is not a component of this approach? Healthcare financing, service delivery, private healthcare dominance, or governance. Of course, we know that Formula One Plus for Health is basically a strategy of the Department of Health to strengthen public health through healthcare financing, service delivery, there's health regulation, and at the same time, governance. But that excludes privatization. So, number 6, the answer is letter C, private health dominance. 7. Which of the following statements best describes the Philippine Integrated Disease Surveillance and Response System? A. It focuses only on infectious disease. Letter B. It aims to provide real-time surveillance of communicable and non-communicable diseases. Letter C. It operates only at the national level. Or letter D. It excludes reporting from the LG. Of course, eliminate nothing in letter H. Letter C because that's absolute only, and also eliminate letter D because that talks about excluding reporting. Answer for number 7 is letter B because this enhances our real-time disease tracking from local to national levels, and at the same time this will also improve our outbreak response and public health intervention. 7, the answer is bravo. 8. The Philippine primary healthcare approach is based on which of the following declaration? A. Ottawa Charter of for Health Promotion. Letter B. Alma Ata Declaration. Letter C. Paris Agreement. Or letter D. Millennium Development Goals. Of course, we know that in 1978 there is the Declaration of the Alma Ata that establishes the primary healthcare, and at the same time build the foundation for healthcare systems in the world and influencing the Philippine healthcare policies, that is through Letter of Instruction 949 or LOI 949 that was signed in 1979 by the late President Marcos. Number 8, the answer is letter B. 9. Was the primary goal of the Philippine Healthcare Insurances Corporation that PhilHealth? Letter A. To provide insurance exclusively for government employees. Letter B. To cover only tertiary care expenses. Letter C. To ensure financial risk protection for all Filipinos. Letter D. To privatize the Philippine healthcare system. Of course, letter D is eliminated because we know that PhilHealth is run by the government. And then, of course, that's not covered only on the tertiary, but it can have a primary, secondary as well. And it is not exclusive for government employees, but it is through to all. Through to all. So under our RA 7875, which is the PhilHealth Act, that actually aims to provide equitable and accessible access to healthcare services, and at the same time that will actually reduce the out-of-pocket expenses among the beneficiaries. Number 9 is letter C. 10. A nurse in a rural health unit is tasked with implementing the Philippine National Immunization Program or the NIP, which of the following vaccines is not included in the routine immunization schedule: BCG, pentavalent vaccine, influenza vaccine, or OPV. Of course, we know that the National Immunization Program includes BCG, hepatitis, pentavalent that includes DPT, Hep B, and Haemophilus influenza B, OPV, IPV, PCV, MMR, and MR vaccines. But influenza vaccine is recommended for individuals who are actually high risk, that belongs to high risk groups, and that's not part of the routine immunization among children. So that is specific for elderly. Number 10, the answer is letter C. 11. Under the Universal Healthcare Act, what is the primary role of primary healthcare providers? To serve as the first point of contact for health services and coordinate patient care, to provide only medical emergency services. Letter C. To perform complex surgical procedures in the community. Or letter D. To issue medical services or licenses and service certification. The best answer is letter A. Services are not provided only in emergency, and it should be uh, simple procedures, and at the same time not the licenses, because it's the responsibility of the Department of Health. Number 11 is letter A. 12. Which of the following best describes the no balance billing policy of PhilHealth? It allows hospitals to charge additional fees to indigent parent patients to ensure that indigent and in sponsored PhilHealth members receive free healthcare in public facilities. It applies only to private hospitals, or it requires members to pay for medicines separately. The answer is letter B, because no balance billing ensures that there's a zero out-of-pocket cost for indigent sponsored seniors and at the same time persons with disabilities, especially in government institutions. That's why we eliminate letter C immediately, because the focus is private hospitals. And there's no additional payment because that's zero billing. 12 is letter B. Let's proceed now to the next topic, which is about maternal, newborn, and child health nutrition. 13. Under the Philippine MNCHN strategy, which intervention is most effective in reducing maternal mortality in community settings? A. Expanding the number of private maternity clinics. Letter B. Ensuring access to skilled birth attendants and emergency obstetric care. Letter C. Encouraging traditional birth attendants to manage deliveries at home, increasing hospital-based deliveries regardless of risk factor. Eliminate natin kagad yung letter C because there's no such thing as home delivery anymore, and there is establishment of our primary healthcare facilities, our line clinics. That's not private. The answer here is letter B, because that prioritizes skilled birth attendant, especially on emergency obstetric and newborn care, or the EMOC, to reduce maternal and neonatal death. The answer here is letter B. 14. The expanded program immunization in the Philippines recommends that the first dose of hepatitis B vaccine should be administered how many hours after birth? Is it 24 hours, 72 hours after the first week, or at 1 month of age? Of course, we know that the first dose of hepatitis B is given within 24 hours, or probably it can be given also alongside with vitamin K and at the same time your hepatitis B vaccine. The answer for number 14 is letter A. After birth, that is prevent transmission of mother to child hepatitis B. 14. Alpha. 15. Which law in the Philippines mandates a promotion of exclusive breastfeeding for the first 6 months of life? Is it RA 9288, Newborn Screening Act, RA 100028, Expanded Breastfeeding Promotion Act, RA 7600, Roaming and Breastfeeding Act, or RA 1152, Mandatory Reporting of Not-Public Conditions? Of course, eliminate natin again letter D because it focuses on communicable disease. And letter C is basically has been expanded with RA 10028. That's the answer from 15 is letter B. Letter A is basically on newborn screening. That means that prior to discharge, there is proper screening of the newborn for detection of congenital and genetic conditions. 15, the answer, bravo. 16, a community health nurse is monitoring compliance with essential interpart of a newborn care protocol, which of the following is not part of EINC? Immediate and thorough drying, skin to skin contact, routine suction of the newborn, or delayed cord clamping. Of course, we know that there's no anymore suctioning because that can cause trauma and at the same time unnecessary stress to the newborn. Unless there's a need for you to do that, then that is implemented. The answer here is letter C. Letter A, B, and D are basically part of your essential interpartum and newborn care. 16, the answer is letter C. 17. Under the Philippine Safe Motherhood Program, what is the primary strategy to ensure safer pregnancies and childbirth in rural communities? Letter A, expanding hospital-based obstetric care. Letter C is strengthening community-based maternal care and birthing facilities. Letter C, strength encouraging home birth attended by traditional birth attendants, or providing free cesarean sections for all deliveries. Of course, eliminate natin galing yung letter D. You cannot provide CS to all. And then encouraging home births, that's actually big no because there's no home delivery anymore. The answer here is letter B. Safe Motherhood Program emphasizes basic emergency obstetric and newborn care in rural health units and at the same time birthing centers. Answer is bravo. 18. According to the Philippine guidelines of infant and young child feeding, when should complementary feeding be introduced? It should be at the age of 6 months. Ideally, it should be at the age of 6 months, but you can introduce already as early as 4 months. So complementary feeding starts at 6 months. That is one way of providing additional nutrients while continuing breastfeeding that can last up until 2 years old. 18, the answer, C. 19. Now, barangay health worker is educating pregnant women about iron and folic acid supplementation with the recommended daily dosage of elemental iron for pregnant women in the Philippines. Of course, we know that 120 is actually too high, especially if, as I've mentioned this one before, if there is the lowest and the highest, do not choose that. The answer here is letter B, that's 60, because that's the recommendation of the Department of Health for iron supplement and 400 microgram of folic acid. That's actually one way to prevent maternal anemia and at the same time prevention of neural tube defects. 19 is Bravo. 20. Under the Newborn Screening Act of under Newborn Screening Act RA 9288, when should newborn screening initially be done? Is it at birth, after 24 hours but within 48 hours of life, after 1 week, or after 1 month of age? Of course, before the baby is discharged from the facility, there's a need for us to do your newborn screening because that's one way of detecting if there's presence of metabolic disorders as early and should be done 24 hours but no more than 48 hours after life. Answer here is Bravo. 21. Which of the following is a key intervention of the Philippine Integrated Management of Childhood Illnesses or IMCI strategy? Focusing only, that's actually wrong because that's absolute. They're providing holistic care for sick children, inclusion, nutrition, and immunization. Hospitalizing all children, no, that's letter C is eliminated because that's absolute also. Encouraging self-medication for minor illnesses. There's no such thing as self-medication because that's a big no-no in the practice. Answer here is Bravo. That's holistic care for children aging 1 year old and 5 years old. 21. Bravo. 22. A community health nurse is assessing a child for malnutrition using mid-upper arm circumference. A measurement of 11.0 centimeter indicates normal nutrition, moderate acute malnutrition, or severe nutrition, acute malnutrition, or overnutrition. Letter D, eliminate. Because less than uh, 11.5 centimeter indicates that there is severe malnutrition that requires urgent nutritional intervention. The answer here is letter C, severe acute malnutrition. 23. The Philippine Meal Code or Executive Order 51 prohibits which of the following practices: providing free breast milk substitutes in hospitals, allowing formula advertisements directed at mothers, or promoting breastfeeding in workplaces. Of course, we know that letter C is the focus of EO 51. The answer here is D, both A and B. Because Executive Order 51 or the Milk of the Philippines prohibits marketing of formula milk to protect breastfeeding practices. 23. Delta. 24. Under the DOH micronutrient supplementation program, when should vitamin A supplementation be given to infants and young children? At birth and every 6 months thereafter. Letter B, at age 6 months and every 6 months thereafter. Letter C, at 12 months only. Letter D, only when symptoms of deficiency appear. Letter C and D eliminate. The answer here is letter B, at 6 months and every 6 months hereafter. Because vitamin D deficiency causes blindness and probably it also produces weakened immunity. Therefore, there is a need for us to have supplementation that will actually start at the age of 6 months and continues every other 6 months. 24. Bravo. 25. Which of the following is the primary focus of the first 1,000 days law or RA 11148 in the Philippines? Providing free hospital care to all newborns, ensuring proper nutrition from conception to a child's second birthday, extending maternity leave benefits, or mandating newborn screening act for all infants. Of course, eliminate that kaging letter H or letter D because that is absolute. So RA 11148 or the Kalusugan at Nutrisyon ng Bananay Act ensures that there is an optimal nutrition from pregnancy to 2 years old to prevent stunting, and at the same time malnutrition. The answer here is Bravo. Okay, so I think that's it. Congratulations, everybody. See you again next time.